Well, the Career and Education Framework is a joint initiative between the UK Oncology Nursing Society and the Royal College of Nursing Cancer and Breast Care Forum. The project itself was initiated in about 2012-2013 with an initial grant from the Higher Education Academy to start the project. Its purpose really is about making sure that the workforce, whoever they are in terms of nursing, so registered nurses and unregistered healthcare support workers, as well as pre-registration students, are able to meet the needs of people affected by cancer. That can be the physical, psychological, spiritual and social support needs, and to make sure that they feel well prepared to support people who are affected by cancer, as I say, across the age span, from health promotion through to end-of-life care, through treatment, disease remission, rehabilitation and recovery, and to, as I say, feel suitably able to support people affected by cancer. So it's been quite a long time in the making. During the last year when we presented at the UK Oncology Nursing Society conference, we got some feedback from conference members, and during this last year we've also piloted the work with registered nurses and those working in specialist cancer services and those working in general cancer care as well. That was across Wales. We've also piloted the work with higher education institutions, mapping the framework against their pre-registration and CPD curriculum. And we received some feedback from the UCON's board as well. So there's been significant development work in the final year, and all of that has fed into the final version, which is currently being designed and printed for publication on the RCN website. Its audience really is to help individual practitioners, service managers, educators, and also policy makers and commissioners. So it's got a range of audiences who we're hoping will find it a valuable resource.
And just to add on that, it's quite timely. We're all doing a lot of the planning work. The strategic boards in the four nations are all working on their cancer plans, and part of that is about workforce planning, and they are specifically looking at the education and knowledge and skills that are required of the nursing workforce into the future. So I think we see this document as a fantastic opportunity for us to direct that from a cancer nursing perspective, instead of perhaps being directed by others, but actually having now the document available for all these commissioners as well to have access to. And I think that will be really good. I mean, the one thing I suppose we feel is that it's everybody has to use it, and they have to give us feedback about how they're using it. And we talk about in cancer care a lot about the nurse specialists, the clinical nurse specialists and their valuable role, but they're one of a bigger team. And with cancer rates rising, that bigger team includes your healthcare support worker, your pre-registration nurse, and your nurse who isn't a cancer specialist. So I think one of the fantastic opportunities we have is to influence other fields and other nurses that aren't necessarily cancer specialists.
And I think that's a key message from it really, that we recognise that nurses, wherever their practice, whatever their role, whatever service, will meet people affected by cancer, and we want them to feel suitably prepared for that. And also we recognise that in the pre-registration undergraduate and postgraduate curricula, often there's variation in the amount of education that's provided to our pre-registration students around cancer and the care of cancer patients. And this is also a significant inclusion within the document to try and make sure that nurses at the point of registration have got this baseline understanding to be able to support patients and their families really.
I mean, moving forward, we would like to embed some evaluation in it, because I suppose we're hypothesizing that if we upskill the knowledge and education of the workforce, then that will have a benefit on the person affected by cancer and their family, because they're going to get the right information at the right time in a timely, in a sort of accurate manner. And we know anecdotally from our own practices that not all nurses know about cancer, and that some of their knowledge is the same as the general public, and therefore it's really important that we kind of not just focus on the person who already knows a lot, but actually upskilling the people who really are caring for people on a daily basis. So I think it's going to be important. We're planning a wide dissemination of it next year, and I think that is in line with the importance of it, but also the fact that, you know, we don't want this just sitting on a shelf or on a website. We want as many nurses as possible to know about it. Absolutely,
and we encourage people to download it once it's available, to use it, and to provide us with feedback. It's it's a new innovation that we hope people will find useful, including those as well who are in specialist roles, because it does distinguish between the different levels of those who work within specialist cancer care as well. And this again is the first time that the different levels of practice have been separated out for those practitioners as well, to clearly identify what the expectations are of their role, the academic level of preparation, as well as the workplace levels of experience. So we want people to use it, but as Sue says, very importantly, to feedback and help us to evaluate it, because it will require updating, and we welcome lots of feedback about how valuable it's been in practice to individual practitioners and to services, as well as to policymakers, to make it as useful as possible in the future as well.